FM Peterborough and Inspire FM Luton 105.1 FM. What an absolute delight it is to join you all again once more on a Wednesday evening, my favourite day of the week. Unfortunately, though, it hasn't been the favourite day of some people that I know, especially my son, Mohammed, who was at home, had a bit of problem with his fractions. So I just wanted to send a message out to him that, Mohammed, Mummy will be back home very soon and I will help you with those fractions. And I promise that you will know how to do them. So that was one upset little boy. But it's absolutely wonderful to have you back on the show with me, your very own doctor. I'm an inner city doctor. I work as a GP in Peterborough. It's an absolute delight to deliver these shows to you, and we try to bring you the best in the name of health and other matters related to it. Now, I have a few announcements to make, actually. It's been a very busy week. I've been keeping abreast with people's activities, and a special young lady I would like to give a shout out to today is Jannat Suleiman, who lives in Peterborough, and I'd really like to congratulate her on the fact that she has been commended for the all school colours at the King's School in Peterborough, and I think it's such a proud achievement. And you are an inspiration for young children the city over, in fact the country over, Jannat, so well done to you. I did promise that I was going to give you a shout out, a very well deserved shout out, and to two listeners of mine, the Timothys. Now, in particular, Mrs. Lynn Timothy. I spoke to you the other day, and it's an absolute pleasure to have you on this show. So thank you very much for listening, and thank you very much for gaining a bit more insight into the world of health. And as usual, it's wonderful to have everybody on the show listening to me. And if you'd like to text and WhatsApp, text us on 07745278978, or you can ring us on the studio telephone number, Peterborough code 01733602133, and you can follow us on Facebook Live, YouTube Live, and on Twitter. How clever is that? Now, I have an absolute pleasure in introducing my next guest, who happens to be a very esteemed guest. And yes, I have been waiting for him to come onto the show, but he's a wonderful gentleman, a wonderful professional, a colleague as well. His name is Dr. Mumtaz Hayat, who's a consultant gastroenterologist and head of the Service of Gastroenterology in Northumbria Healthcare NHS Trust. He's a lead colonoscopist, North of Tyne Bowel Cancer Screening Program. Now, I'll tell you a little bit about Dr. Hayat because he's actively involved in teaching and training of endoscopies, which are the camera tests that you can have, and colonoscopies, and also a procedure which is known as ERCP. And Dr. Hayat's clinical interest also lies in therapeutic endoscopy, colonoscopy, endoscopic mucosal resection, colorectal stenting, endoscopic retrograde, cholangiopancreatography, that was a mouthful, but I managed to say it, and inflammatory bowel disease. And in this week's show, we're going to be talking about bowel cancer, its risk factor, and bowel cancer screening. Dr. Mumtaz Hayat, Assalamu alaikum.
Wa alaikum assalam, Dr. Shabina. How are you?
I'm fine, thank you. What an absolute delight to have you on my show today, and thank you very much for your valuable time.
No, thanks to you for inviting me in, for the radio talk.
Oh.
I'm really honored.
Oh, and it's lovely to have you on. In fact, looking at your introduction, you have so many different hats. Your day must be quite busy. It must be quite hectic.
It certainly is. Yes, you're absolutely right. I've got a very busy clinical practice, but also obviously few management roles. So it's quite busy, but I thoroughly enjoy it. It's good to be busy.
Well, that's a wonderful thing about health professionals. I think that if you enjoy doing something, you can do the best of your potential to it, and you can do justice to it as well.
Exactly.
Yes, that's right. Now, you are aware of the fact that we are talking about a very pertinent topic today. In terms of statistics, we're talking a little bit about colorectal cancer, talk a little bit about the screening program. But how important is it for people to be aware of their own gut health, Dr. Hayat, before we move on?
So, Dr. Shabina, I can't stress enough, it's an extremely important topic, and especially more pertinent and important to the Asian population.
Yeah.
Now, bowel cancer is the fourth commonest cancer in UK,
Right.
and the second commonest cancer death cause in UK. So it's a big burden. I mean, in the statistics which were given by the Cancer Research, 2015-2016, there were about 43,000 new cases diagnosed of bowel cancer every year.
Wow.
And as the important thing about bowel cancer is that if it is detected early in stages 1 and 2, then there's a great chance of survival to the extent of 5-year survival of about 95%, 98%.
Right.
However, if bowel cancer is diagnosed pretty late, stages 3 and 4, which we say, then the cancer survival, 5-year survival goes down to 7%, 8%. So I think it's extremely important that we should be aware of this issue and take it very seriously.
Of course. And in terms of your own interests, you've given us some wonderful statistic. I think it's quite staggering to see that figure, that it runs into the thousands in terms of diagnosis within the United Kingdom in regards to bowel cancer. But in yourself, what inspired you to actually become a lower gastroenterologist, a lower GI specialist?
It's an interesting question. I graduated from Alama Iqbal Medical College, Medical University in Lahore. And then I started my initial training in Services Hospital, Lahore.
Okay.
And that was a GI ward. And that's where, looking at the spectrum of the GI diseases, upper GI problems, lower GI problems, liver disease, that was the thing which, sort of gave me interest to develop myself as a gastroenterologist in the future. The other thing which I find really interesting about gastroenterology is that although it's a medical specialty, there's a lot of interventional stuff which you can do, especially these days now, which gives you a flavor of minimally invasive surgery also.
Yeah.
And it's funny that some of my surgical colleagues call me a frustrated surgeon because because of my interest in the therapeutic side of the endoscopy. So that was one of the reasons I picked gastroenterology as a specialty to develop.
Yes, and I think it's quite interesting that many procedures, not particularly to gastroenterology, but it's amazing with the advent of technology, how many procedures have become sort of laparoscopic and minimally invasive.
Exactly.
And how that can increase the scope of physicians who are otherwise very actively taking part in very big names internationally in regards to sort of minimally invasive surgery. So very, very interesting indeed. And
Sure.
if I were to ask you, for the purpose of knowledge of our listeners, Dr. Hayat, because we do have people who don't really understand the medical terminology, could you explain to our listeners a little bit about the normal working of the lower intestinal tract or the lower gut, please?
Sure, yeah.
Thank you.
So if you imagine, colon, what we call the large intestine, as a tube,
Yeah.
as a bendy tube, so to speak, it's about 5 to 6 feet long. And the main function of the large intestine or the colon is threefold.
Mm-hmm.
So what it basically does, the main important function obviously is to get rid of the toxic material of the body. So any undigested food, is excreted through the large bowel.
Okay.
It also helps the proximal part of the large bowel, or what we call the right side of the large bowel, helps with the absorption of significant amount of water and sodium in our body, salt in our body.
Right.
And the third important function of the large bowel or the colon is that it gets rid of, detoxified stuff from the biliary system, which is excreted out of the liver. So that's one of the most important functions of the large bowel. And as I said, it's a flexible, bendy tube which is about 5 to 6 feet long. Mm-hmm. There are different parts of the large intestine, what we call, in medical terms, cecum, ascending colon, transverse colon, descending colon, sigmoid, which is the S-shaped part of the large bowel, and the lower bit of the large bowel, which is called the rectum, and then the anus. So that's sort of in summary what the large bowel consists of.
Okay. And like for purposes of all of those that who have joined just now, I am hosting Dr. Mumtaz Hayat, who's a consultant gastroenterologist in Newcastle and in North Tyne, and we are talking about bowel screening. You just explained the function of the bowel and the different part of the lower bowel as well. And in order to have a good working bowel, before we go on to the abnormalities of the bowel, Dr. Hayat, what is your advice to our listeners?
Yeah, I think that's a very important question, Dr. Shabina, and I'm sure as a GP yourself, you would be aware. I think lifestyle plays an extremely important role in a healthy body and a healthy bowels, which is obviously part of our body. If you look at the causes of bowel cancer, in addition to the hereditary factors and the genetic factors, which unfortunately we can't do much about, changing those factors, lifestyle is one of the things which improving your lifestyle or changing your lifestyle is an important part of a healthy bowel and preventing sort of developing cancer in the large intestine. Okay. As an example, smoking is one of the major factors of developing or increasing the risk of colon cancer. Okay. In addition to that, excess alcohol intake is an extremely important factor in the development of colon cancer. If you look at our diet, things like red meat, excessive consumption of red meat and processed meat, that increases the risk of bowel cancer. And recently, there has been a lot of interest in, being overweight or obesity. And actually, you'll be surprised to hear that obesity plays such an important factor in increasing the risk of bowel cancer, that obesity per se increases the risk of bowel cancer to up to 14%. Okay. So these simple lifestyle measures, exercise, being physically active, also is an important part. So these are very simple measures which we can adopt and do and change our lifestyle at a very minimal cost with great benefit to our health and the health of our colon.
Very well said. And we often see adverts out in public displays, billboards, etc., explaining that obesity is actually probably the second biggest risk factor towards developing a cancer. Is it established as to what the link between obesity and development of colon cancer is? Is there a reason why that is, or is that it's just been identified as a risk factor?
I think it's been identified as a risk factor, and they're very clear, data as because of the obesity, increased risk of colon cancer. As to the cause why that happens, that could be multifactorial, as I mentioned to you before, lack of physical activity, sure, consumption of bad food, less fiber, more red meat, processed meat, alcohol, smoking, all those factors I think contribute. Diabetes could be another one, obviously, being overweight increases the risk of your diabetes, and diabetes per se could increase the risk of colon cancer. So I think, it's multifactorial, but that's one of the reasons, why obesity is linked with increased risk of colon cancer.
Correct. And obviously from obesity, I normally do say that obesity itself is one of the risk factors to many other conditions. We have diabetes mellitus, which in itself is a risk factor to developing other conditions as well. And I've got a question here from a brother Arif, who says that, Dr. Hayat, this is a great show. Thank you very much indeed. I would like to ask you, is constipation or being constipated long-term a risk factor to developing colon cancer?
So if in a short answer, I would say no. Okay. However, if you are constipated, then I think you need to look at your diet because obviously, there could be certain factors in the diet which might be predisposing you or a person towards constipation. And as I said before, lack of fiber in the diet, which I'm sure you would have heard, and I'm sure Brother Arif would have heard. The 5 fruits a day, which is, a strategy which you can use to improve your general body health and the colon health also, and to regulate your bowels. So I'd recommend that a lot to my patients, high fiber diet or increase the amount of fiber in the diet, along with plenty of fluid intake or liquid intake, which is, again, a very important factor. Increase physical activity, which is a very important factor, and cutting down on the consumption of red meat and processed meat. So all these factors, would improve the symptoms of constipation. One thing to say is that if the constipation is not long-standing as a new symptom, or there's any change of bowel habit, then I think that should be taken very seriously, and you must consult your GP regarding that and make sure that it's investigated properly.
Yes, I completely agree with you there, Dr. Hayat. And it's amazing how many people, I can remember when I was little, there was a greater emphasis on eating fresh food, and we would have, yes, I mean, there are takeaways, but it's very interesting that we are actually talking about diet and the state of gut health and how to increase or help good eating, wisely, and having good dietary habits, because there is a lot of emphasis on your 5 a day. And again, with the advent of medical research, we have been able to establish that fiber is very important in our diet. But I do remember back in the early 80s and in the 70s, when fast food and processed food wasn't such a readily available commodity. People were eating a lot more. And indeed, in my own general practice, I do see lots of people, every other person is suffering from constipation. Every other person is. And I do feel that a lot of this is because food is readily available. You can go around to your fast food outlet and you can go and, I don't know, pick up chicken and chips. Children aren't eating as healthily as they should. And it may, I'm not sure where we stand with regards to research, but the accumulation of toxins, etc., bad type of fats consumed within the diet, sedentary lifestyle, less exercise, is indeed leading to obesity, which then is proven to be a risk factor for cancer.
Very true. I totally agree with that, Dr. Shabina.
So it's wonderful to hear that and to, again, emphasize. And like I say to all of you listeners, that it's so important to eat a very healthy diet. We really do need to be looking at this, where we can cut down on unhealthy eating habits. So as I say in all of my shows, decreased smoking, as Dr. Hayat has very rightly put as well, can be a risk factor. And also the fact that obesity, so looking at the way we're actually feeding our children. In fact, on a very famous radio show this morning, as I was driving into work, they spoke exactly about that. And there were people who were very passionate about it and saying that perhaps the government needs to step in. They've put in a new sugar tax. They need to step in about actually taking control away from parents and fining them or penalizing them for the food that they give to their children. But that's a completely different discussion to have.
Exactly. and a very sensitive topic also.
A very sensitive topic. You're absolutely right. Now, moving on a little bit to the facts about colon cancer. I know that there are different types of colon cancer, Dr. Hayat, but would you possibly please tell our listeners a little bit about the risks associated with colon cancer? And is this hereditary?
Sure. So as I mentioned before, yes, it is hereditary, and colon cancer can run in the families. So if you've got any first-degree relatives who have been affected with colon cancer, then the risk of developing colon cancer increases significantly. And we do recommend that if anybody has got one first-degree relative or two first-degree relatives in their family who have been affected with colon cancer, then they need to have their colon checked on a regular basis.
Right.
Then obviously there are genetic factors. So there are certainly some well-established genetic conditions. I'm going to use medical terms here, things like, sort of polyposis syndromes, which can increase the risk of colon cancer. And again, those patients or patients belonging to those families who have got these genetic conditions needs to be monitored and have regular surveillance colonoscopies.
Right.
As to the other causative factors are concerned, as I've mentioned before, the dietary factors or the lifestyle factors, including increased consumption of smoking, alcohol, processed red meat, being overweight, less physical exercise, that can cause increases the risk of colon cancer. Then there are certain inflammatory conditions of the large bowel or the colon. I'm sure everybody would have heard about ulcerative colitis or Crohn's disease.
Right.
So if anybody has got, a condition causing inflammation of the colon, that can also increase the risk of developing colon cancer, and we need to keep a close watch on these patients. There are certain endocrinological disorders. There's one which comes to the mind is acromegaly, which is a condition whereby there's excessive growth hormone in the body.
Right.
And that increases the risk of colon cancer also. But by far, as I've said before, the commonest things are hereditary factors, genetic factors, lifestyle factors, and the presence of colitis or inflammation in the body.
Right. So it's important to have a look at that. In the meantime, I've had another question that's actually come in from a sister Naima, who asked, Dr. Hayat, thank you very much for raising this very important topic. Great show as always. Thank you very much, Sister Amna. And she is asking if all types of colon cancer are said to be hereditary, or is it only specific types?
No, specific types. As I've said before, sure. not all colon cancers are hereditary. There are certain genetic conditions which I've mentioned before, polyposis syndrome or Lynch syndrome, which can lead to sort of genetic defects causing, the problem with the genes and increased risk of colon cancer. And then there are sort of cancers which can run in the family, which I've said are non-genetic but hereditary colon cancers. But not all colon cancers are hereditary and can develop as what we call sporadic cancers.
Okay, so that's a good one. I hope, Sister Amna, that this has answered your question. Indeed, it's very important to realize that when we are looking at an individual that has suffered from colon cancer, it is important to establish the link of that cancer and if it does have any genetic inherited tendency, and thereafter you will definitely be managed or you will be screened, as Dr. Hayat has said. Now, in terms, Dr. Hayat, of colon cancer itself, I think it's important to start from the basics so that we can then go on and talk about screening, which hopefully should come after the break. So what are the basic signs and symptoms to look out for if somebody is suspecting, for example, cancer?
Yeah. So it's a very pertinent question, Dr. Shabina. And one of the problems we find with the symptoms of colon cancer is that these symptoms are so common, and a significant proportion of people or patients who might turn out to be irritable bowel syndrome exhibiting these symptoms. But the one thing which I would like to emphasize is not to ignore the symptoms, and they should be promptly investigated. Now, the common symptoms which a person can exhibit, and I must stress that doesn't mean that they've got colon cancer, but these symptoms should be taken seriously and should be investigated promptly. They include bleeding from the back passage, which could either be in the form of fresh blood or altered blood, what we call dark blood. Now, the commonest cause of fresh bleeding from the back passage is hemorrhoids, which is very common. There are other sort of benign conditions or simple conditions like diverticular disease, which are wear and tear in the bowel, pockets in the bowel, which can get inflamed from time to time. They can cause bleeding also. Colitis can cause bleeding. So, as I said, bleeding from the back passage doesn't necessarily translate into colon cancer. However, is a significant, serious symptom which should be investigated promptly. Other symptoms include change of bowel habits, which I've mentioned before. So, any unexplained change of bowel habit in the form of diarrhea or passing loose stools, constipation, which as I said before, if it's not a chronic symptom, a new symptom or a change of bowel habit, should be investigated. Presence of any colicky abdominal pain or sort of a crampy abdominal pain. Bloating, which again is a very common symptom, but should be taken seriously in the right context. Then if you go and see your GP and the GP can feel a lump in your tummy or lump in the back passage, that should be taken seriously and should be investigated. And then sometimes you don't have any symptoms and you just go to your GP for a checkup or with complaints of tiredness and shortness of breath. And on the blood test, it's found that the person has got anemia because of blood loss. So that should not be ignored and should be sort of flagged up for prompt investigations.
So quite a few things to look out for here. And it's wonderful that we're actually talking about this. We are coming up to a break in the next 60 seconds. So if you've just joined us, I'd like you to welcome Dr. Hayat, Mumtaz Hayat, who is a consultant gastroenterologist up north, and he has taken his valuable time out to explain a little bit about the significance of bowel screening, which we'll be talking about after the break. And in the meantime, it would be wonderful if we could have some questions in. We've already got quite a few people who've joined us. We have Dr. Azad Chaudhry. Thank you very much for joining us. We have Dr. Sajad Mughal. Thank you very much for joining us. And Maruf Khan and Santosh Pamnani. It's wonderful to have all of you here listening to this show today, which is very encouraging for us, as well as all of you in the community. So it is wonderful to have you on the show. Please join us again after the break, where Dr. Hayat will be telling us a little bit more about bowel screening and why we should go for bowel screening, especially in the Muslim and Asian ethnic minority communities. Don't go away. Stay tuned.
Have you visited Amar Food Store yet? Now open at Lincoln Road Triangle, 613B Lincoln Road, Peterborough. Pay us a visit and take advantage of our special offers and great range of products on groceries, vegetables, fruits and halal meat. All your favourite brands under one roof. We take payment by card, have free customer parking and offer a free local delivery service. Also available, PayZone for bill payments and money transfer services to Pakistan. Amar Food Store and Halal Meat. Now open at Lincoln Road Triangle. Call us on 01733 68 73 74. High in quality, low in prices. Third world and developing countries are home to some of the most vulnerable children on the planet. Malnutrition, severe lack of medical aid and access to clean water are just some of the horrific challenges faced by orphans across Africa and Asia. Children of Adam, a Peterborough charity, need your help to bring aid to these orphans for just £25 a month. To sponsor an orphan or assist with other projects, please call 0300 321 0032 or visit www.childrenofadam.net.
Need a great place to chill out? Look no further than The Lounge for quality food and drinks at a great price. Try our varied menu: pasta, seafood, burgers, grills, salad, soup, rice and sides. Also hot and cold drinks, milkshakes and mocktails. Leave room for our exquisite desserts. The Lounge, 417 Lincoln Road, Peterborough. Call 01733 709 306 to order for delivery. The Lounge, friendly service with a great atmosphere.
सलाम रेडियो और पेनी अप्रील ने एक शाम का बंदोबस्त किया है। कवालियों की शाम उस्ताद नुसरत फतेह अली खान के नाम, जहां चांद अली खान कवाल और पार्टी बाकायदा हमें अच्छी सी कवालियाँ सुनाएंगे और उनके अलावा मुशायरा और गज़लें भी होंगी। और जो भी पैसा होगा वो पाकिस्तान में पानी के कुएं लगवाने का बंदोबस्त किया जाएगा। और ये चैरिटी का प्रोग्राम है। ये संडे इतवार 29 अप्रैल को होगा ग्लैडस्टोन पार्क कम्युनिटी सेंटर में। दरवाजे खुलेंगे 6 बजे। टिकटों के लिए आप कासिम से रब्ता करें, सिर्फ £10 टिकट है। कासिम का टेलीफोन नंबर है 077 22 55 884। 29 अप्रैल 6 बजे उस्ताद नुसरत फतेह अली के नाम एक शाम, जहां चांद अली खान कवाल एंड पार्टी आ रहे हैं। इसमें ज़रूर तशरीफ़ लाएं और चैरिटी को सपोर्ट करें। शुक्रिया।
Bismillahirrahmanirrahim. On the authority of Abu Muhammad al-Hasan, the son of Ali ibn Abi Talib, the grandson of the Messenger of Allah, may the blessings and peace of Allah be upon him, and the one much beloved of him, may Allah be pleased with them both, who said, I memorized from the Messenger of Allah, may the blessings and peace of Allah be upon him, leave that which makes you doubt for that which does not make you doubt. It was related by Al-Tirmidhi and An-Nasa'i, Tirmidhi, saying that it was a good and sound hadith.
Broadcasting 24 hours a day, 365 days a year. This is Salam Radio.
Assalamu alaikum and welcome back to your very own Body Health and Mind Show on Salam Radio 106.2 FM and on Inspire FM 105.1 FM. So we're talking very important topic. It is the topic of bowel cancer. We have an absolutely wonderful guest, Dr. Mumtaz Hayat, who's a consultant gastroenterologist who joins me now. We are live on air. And as usual, we would love to have your text messages on WhatsApp on 07745 278978, or you can join us on the studio telephone number 01733 602 133. And actually, on that, I'd like to ask, why don't many of you actually phone in and talk or ask questions about medical problems? There's no need to be shy. I have plenty of written questions that actually come in. But yes, come on, give us some company. It'd be wonderful to hear your views, whether it's on the show, whether it's about any other medical problem at all. It would be an absolute pleasure to have you on. You would be my special guest as well. So coming back to our topic regarding bowel cancer, we're going on now to talk a little bit about bowel cancer screening, and we do have the esteemed Dr. Mumtaz Hayat, who's going to be talking a little bit about bowel cancer screening. And Dr. Hayat, thank you very much for staying with us during the break. Bowel cancer screening is offered to everyone as part of the NHS bowel screening program. Now, could you tell us a little bit about this, when it's done, and the importance of it, please?
Sure. So, bowel cancer screening program, NHS bowel cancer screening program, I must say is one of the most successful screening programs in UK.
Okay.
It started in 2006 and was fully rolled out in December 2009. Okay. It's offered to subjects. I mean, the reason we call them subjects is that they're not patients. So these are asymptomatic people in the general population. Right. From the age of 60 to 74, they are sent an FOB, what we call fecal occult blood kit. Sure. Where the check, they have to provide us with 3 stool samples. If they come back as positive, then they are invited to come to see what we call a specialist practitioner in the office to go through the history, any medications, any other issues. And then they offered a colonoscopy, which is performed by bowel cancer screening program accredited colonoscopists. Okay. So these accredited colonoscopists have to go through stringent criteria and examination. Actually, these are established consultants, but they have to go through stringent criteria and examination to be a bowel cancer screening colonoscopist. Because obviously the important part is that these subjects are not patients, so we have to make sure that the risk of complications are very minimal and there's no harm done to our patients and our population. So as I said, patients, people from 60 to 74 are invited. Okay. They get their colonoscopy, and then depending upon the results of the colonoscopy, if we find any significant polyps or cancer, then further treatment is done. Okay. If their colonoscopy is normal, then they're discharged back to their GP with the further kit sent in 2 years' time. So it's a rolling sort of invitation every 2 years until the age of 74 for them. There's another aspect of the bowel cancer screening program, what we call the Bowel Scope program, where subjects at the age of 55 are sent an invitation for a one-off flexible sigmoidoscopy. So I'm sure your listeners would know the difference between a flexible sigmoidoscopy and a colonoscopy. So colonoscopy is the examination of whole of the large bowel or whole of the colon. Okay. While flexible sigmoidoscopy is the examination of the left side of the bowel only. Right. So the second aspect of the program, as I said, is what we call a bowel scope, where at the age of 55, they're sent an invite for a one-off flexible sigmoidoscopy. And if we find any polyps, then they are brought back for a full colonoscopy. But if the flexible sigmoidoscopy is normal, then they're discharged back to their GP. So that what it sort of entails.
Okay, so there really are quite a range of screening programs. Now, what is the importance of these screening tests or investigations or procedures in detecting bowel cancer? Do we have any rates of sensitivity or specificity at all?
Yeah, they are very important, very successful programs, as I said to you before.
Yeah.
I mean, I can give you example. There are obviously, different regions running these bowel cancer screening programs. So our bowel cancer screening program is called North of Tyne, which is a collaboration or partnership between two trusts. So it's our trust, the Northumbria Healthcare NHS Trust, and the Newcastle Trust, which is our neighbouring trust.
Yeah.
Our catchment area is about 850,000, so it's a big catchment area. And if you look at the results, I mean, the amount of significant polyps we have found in our bowel cancer screening, because I've been doing the bowel cancer screening since inception in our region in the North of Tyne, so for the last almost 10 years now. And we are finding significant polyps, which are precursors of bowel cancer, in about 40 to 50% of our population. Okay. So these are people who have got no symptoms whatsoever. They come for a positive stool sample, come for a colonoscopy, and we find a significant polyp, which could be a precursor of a bowel cancer in the future, and we get rid of the polyp there and then, preventing cancer. As far as picking up cancer is concerned, the rate in the North of Tyne is about 6 to 10%. So we're picking up cancer in this. And again, as I must stress that these are not symptomatic patients. These are asymptomatic, sort of subjects where we're finding significant early cancer. And the aim is to reduce the risk of death with colon cancer down to 16 to 20%.
Right.
So I think, it seems as if, the program is very successful and is doing a great job in reducing the risk of bowel cancer.
That's wonderful. Now, Dr. Hayat, I've got a question here from a Dr. Aziz as well. He doesn't give which speciality he's a doctor in, but thank you very much for asking for your question, Dr. Aziz. Thank you very much, Dr. Shabina and Dr. Hayat, for a wonderful, informative program. I would like to know, in terms of giving information to my patients, as to what could be the cause of polyps. Do we know this cause?
Yes, we do. Again, I think, as I said to you before, Dr. Shabina, that polyps are sort of precursors of cancer. So I think as far as the causative factors of the polyps are concerned, we can classify them into hereditary conditions or genetic conditions, and again, the lifestyle issues. And the genetic condition, which I've already mentioned before, things like, familial polyposis syndromes, Lynch syndrome, which can increase the risk of polyps and then subsequently colon cancer. And then the lifestyle factors, which we have mentioned before a few times in the program, the dietary factors, the lack of exercise, being overweight, all those sort of stuff. Polyps, I must say, are very common in the UK population. About 20% of the UK population would have polyps at some stage. So we do come across them, significantly in our practice.
Okay.
But the important thing about polyps is that they are precursors of cancer, colon cancer. And if you can, what I always say, nip the evil in the bud, that's, we could win the fight against colon cancer.
That's absolutely right. And is there any reason why it's more prevalent in the UK population? Is it again lifestyle, like you say?
I think lifestyle and obviously the genetic factors. The one thing I would like to say though is, I go to Pakistan on a regular basis to teach on the colonoscopy courses. Sure. And I was recently in Pakistan in Multan, where I was teaching on a colonoscopy course, and we had this discussion there. With the local gastroenterologist, very highly trained gastroenterologist. And the impression was that we don't see many polyps in Pakistan. And my take on that is that what I said to them was, whether you don't see them or you don't look for them. And it's an interesting thing because the very next case, colonoscopy in a young guy, which the trainee performed, we found a significant polyp in the right-hand side of the colon, wow. Which has never been, seen in that local population by the local gastroenterologist. So I think that proves the point that, if you look for them, you'll find them. So I mean, although, as I said before, that I think polyps are much more common in the UK population, and that could be related to dietary factors and the genetic factors.
Yes, and one thing that I think that I have taken away from this in terms of, we all as GPs get the reports back of the colonoscopies, and often it is said in the colonoscopy where a polyp is found that the polyp has been removed and it's been sent for biopsy, and as a GP you look at them and think, oh yeah, well, okay, that's fine. And myself, I won't say that gastroenterology is my forte, although I do take an interest in it, even more now that I'm hosting yourself. But I do think that you have taught me something that I should then be, from a primary care perspective, would I need to be ensuring that these patients are particularly at risk of developing symptoms further that could be suggestive of a symptom of bowel cancer, or no?
So not all the polyps. As
Sure.
I said, there are different types of polyps. So there are polyps which are what we call, all polyps are benign effectively, but there are certain types of polyps, for what we call in medical terms hyperplastic polyps,
Right.
which do not predispose to colon cancer. But certain types of polyps, things like what we call in medical terms again tubuloadenoma, tubulovillous adenomas, or sessile serrated lesions. So these are sort of specific types of polyps which can turn cancerous. While we're talking about the polyps, one thing I would like to mention is obviously, as I said, that if a patient or a subject has got polyps, then depending upon the type and the number of the polyps, they could be at increased risk of developing more polyps or cancer. And our British Society of Gastroenterology has developed certain guidelines of surveillance of these patients or follow-up of these patients, whereby once you've removed the polyps, then we do bring them back for regular colonoscopies at either a yearly interval, 3-yearly or 5-yearly interval, depending upon the type and the number of polyps which you have found on the index colonoscopy.
Okay, that's very interesting. And I have a question here. The brother chooses not to give his name, which is fine. Thank you very much for the informative shows, Dr. Shabina. I would like to ask Dr. Hayat that if, for example, my father hasn't availed any of the bowel cancer screening program and he is now 76-year-old, could he still request to have a screening test done?
He can, yes. There is what we call a self-referral, whereby if you're above the age of 74, you can go and ask your GP and self-refer yourself to the bowel cancer screening hub, and you can volunteer to provide the stool sample, and if obviously the stool sample is positive, then go for a colonoscopy. So the answer is yes.
Okay, well, that's very reassuring. I must say that I would not have known that answer. So that's something for me to say, because I do get patients who say to me, for example, even with regards to breast screening, for example, I will get patients who say to me, I never went for my mammography, or I was abroad, I couldn't avail it, and now I do want to. And is that something that can be possible? And we are left sort of quite blank-faced. So I think it's really important. And that's a really good question, brother. So thank you very much for that question indeed. And Dr. Hayat, in terms of statistics, we've already spoken about bowel cancer being prevalent in any other community. And you did say at the beginning of the show that it was more prevalent within the Asian community. Was I right in hearing that?
No, more prevalent in the UK, in the English, Caucasian community. That's right, yeah. So it's more common in Caucasian population, but obviously still an important disease, not to be dismissed or ignored in the Asian community. And I'm sure you would agree with me that I think in the Asian community or Muslim community, obviously we do feel embarrassed, regarding discussing these issues. And obviously there's an issue of hygiene where we are reluctant in providing the stool samples. But I would really stress the importance of not ignoring any symptoms and making sure that you go and discuss with your GP, because obviously, GPs are the gatekeepers. Yes. And are important part in the healthcare system in UK. And I think the patients must go and speak to their GPs about further investigations of their symptoms.
Very correct indeed. And I think, Dr. Hayat, you've pointed out something very important, because I often say to a lot of my patients that it's fine with regards to appreciating that you have symptoms, but we as doctors, we don't see you necessarily as someone who is male, female. We have no judgment. We see you as a patient. We see you as somebody who needs to be given help, and that is one of the reasons why we need to carry out the pertinent investigations, examinations, onward referral if necessary, so that we can get to the root cause of your problem. And that leads to my next question here, because I do often have some questions that can be quite, I would say, quite direct, which is good. We like you to give us direct questions. And I have a brother Imran who says that I can't stand the thought of leaving excrement samples on my mantelpiece for 3 days.
I know.
So what do we say to that? Obviously, there is the option of cleanliness and people who pray often with regards to what's your message for them? Is there any other way that they could store these samples in an effective manner?
Yeah, but well, I mean, you don't have to leave the samples on the mantelpiece. I mean, you can obviously.
I don't think your family would appreciate that, Brother Imran.
No, exactly. You can put them in a bit more discreet area.
That's right.
I think it's a real problem and a real issue. And I think it's not only the Muslim community. I mean, our Caucasian population also find it quite difficult sometimes to deal with the stool samples and could be reluctant. And as I said before, although NHS Bowel Cancer Screening Program is a very successful program, but the uptake is still not 100%. The uptake for the fecal occult blood testing and even the colonoscopy is in a range of about 50 to 60%. And in certain areas, like, London and Tower Hamlet area and East London, the uptake is in the order of about 33%. So it's still a big issue. Yeah. And I think there's a lot of education, a lot of, stress or advice which can be given by the general practitioners to the population that they should come up for these investigations. The other thing which I would like to mention that, as I said, many people do find these fecal occult blood testing a real problem. There is a plan to bring out a new test, which is called the FIT test, fecal immunochemical test.
Okay.
Which could be a bedside test, actually, so where you don't have to store the feces sample and send it in the post to the hub, and it could be done at in the patient's house or the subject's house in their privacy. Right. So that might, and the hope is, Scotland has already taken up the FIT testing for the bowel cancer screening program, and we are hoping that in England and Wales that would be taken up, and there is a hope that once the FIT testing is introduced, the uptake for the bowel cancer screening program would also improve.
Right. And that seems like quite a reasonable alternative for those who think that it's rather tedious. But again, like Dr. Hayat is saying as well, your health, you have a responsibility towards your health. And I often say this as well to many of my listeners, that not only do you have a responsibility towards your health, but you have a responsibility to look after the life that has been granted to you as well in the best possible way. So it's a privilege that we have the NHS and we have this setup whereby we are offered these tests and investigations completely free. So it's imperative, I would say, that if you see it as an inconvenience, that inconvenience isn't going to last you a lifetime. Instead, it may well spare you a lifetime of inconvenience if you were, God forbid, to find out that you were suffering from bowel cancer as well. Absolutely. I have another question over here from a brother Asim, who says that, is it true, Dr. Hayat, that younger age people don't necessarily suffer from bowel cancer as much as older people do? And at what age can we consider being really at risk of bowel cancer?
That's a very good question, and it's true to some extent, and I agree. If you look at the data and the research, the incidence of bowel cancer increases after the age of 50, and majority of the bowel cancers are diagnosed after the age of 50. Nevertheless, in my clinical practice, and my colleagues also have seen young patients who have been diagnosed with cancer, as I said, 50 is the cutoff, but I think I'm just coming back again to the same, and I might sound a bit repetitive,
sure.
But I must say that even in young patients, if you've got any new symptoms which cannot be explained, do go and speak to your GP and make sure that they investigate it. Also in young patients, if you've got a strong family history, of colon cancer or any other cancer, then I think any change of symptoms should be taken seriously and investigated. So the short answer is that yes, age is a factor, and majority of the cases of bowel cancer are diagnosed above the age of 50, but that does not mean that the young people cannot get colon cancer. They do.
Absolutely, which is why it's even more important to have a look out for symptoms. So if you are in the younger age group, and Dr. Hayat, and I always suggest you all to have a look back on the shows, take on board some of the symptoms that Dr. Hayat has described and look out for them. And without further ado, go to visit your GP if you are suffering from any of them. I have a sister who doesn't wish to disclose her name, who says, Dr. Hayat, thank you very much. It's a wonderful show. In fact, I take a lot from these shows because I'm able to listen to these shows for the comfort of my own home. Thank you very much, sister. And she said that how much blood would one expect to see if you are suspecting colon cancer? And is one episode of slight blood on the tissue paper a sign of cancer, or should I ignore it?
So as I said, sure. Again, Doctor, is a very good question. And as I said before, I think it's difficult to quantify any amount of bleeding which is unusual or new should be taken seriously. And as I said before, that bleeding from the back passage doesn't necessarily translate into diagnosis of cancer.
Sure.
It could be something as simple as hemorrhoids, as simple as diverticular disease, or a tear in the back passage, what we call anal fissure in medical terms.
Right.
But unless it has been investigated, you cannot assume that it's because of a benign condition. So regardless, we do see patients who have had blood on the toilet paper alone. So there's no large amount of blood in the poo. It's just a small amount of fresh blood on the toilet paper, which brings them to for investigation, and we find a cancer. But a bleeding from the back passage doesn't necessarily translate into colon cancer, but should be investigated, and it could be something as simple as hemorrhoids or tear in the back passage, but should not be ignored.
Okay, so that's the main message that Dr. Hayat has given to you. And we're coming to the end of our show, which is such a shame. These shows pass by so quickly. It's unbelievable, but it's such a privilege to have you on these shows. And what message would you like to give to the listeners, Dr. Hayat, in a nutshell, about bowel cancer screening?
Yeah, so I think in a nutshell, Dr. Shabina, I would say to your listeners that don't be embarrassed to discuss your symptoms with your GP. If you're worried about anything, go and have a chat with your GP and discussion with your GP and get yourself referred into the bowel cancer screening program. It's a great program. It's performed by very trained colonoscopist. It's not without risk. The procedure is not without risk, but it's a very safe procedure, and we do try our best to make it, very comfortable for you. And obviously, we have had loads of stories of good outcome with the bowel cancer screening program. So, go and see your GP, and if you're worried, get your symptoms investigated.
That's a main message to all of you out there. So all our listeners in Luton, all of our listeners in Peterborough, in fact, the world over, because we have had listeners that have been listening the world over. Dr. Mumtaz has very, very nicely and eloquently put the reasons for going for bowel cancer screening, and the fact that we do have the privilege of receiving the best medical treatment probably in the world with regards to, and it's all free because it's on the NHS. So how much fortunate can we get? And if it's being provided to you, do avail it. Think of it as a blessing. It's a blessing coming your way, and you won't have to worry about it for the rest of your life. Obviously, when you do have it every 2 yearly, that's another matter altogether. But to avail it is the primary step that you need to take to look after your health. And without further ado, we did have one question on somatoform disorder asked by Dr. Santosh Pamnani. Dr. Santosh Pamnani, I do assure you that we will be asking Dr. Hayat to come again on the show, because somatoform disorder is something else. But thank you very much for your support. And Dr. Mumtaz Hayat, thank you very, very, very much for coming and joining us on this show. It was an absolute pleasure.
No, thank you very much, Dr. Shabina, and the pleasure was entirely mine. It was, thanks for your invitation.
Thank you very much, and assalamu alaikum to you.
Wa alaikum assalam. Thank you.
And without further ado, we have yet once again run out of time. Now, it's very important. I'm going to give you a very important event here that's going to take place on Sunday the 29th of April, and tickets are £10 only, and this is something I absolutely love. I love Qawwalis, and we have our very own Qawwali show in Peterborough. And do you know, somebody was saying to me just the other days that we need to have more innovation, more art, more Qawwalis, and we've got it for you. Salam Radio is going to be, on behalf of Penny Appeal, hosting the Qawwali show, which is a tribute to Ustad Nusrat Fateh Ali Khan. And how many of us love Nusrat Fateh Ali Khan's Qawwalis? And it's going to be a live performance by Chand Ali Khan Qawwal and Party with Mushaira and Ghazals. Doors are open at 6 o'clock at the Gladstone Park Community Centre, and tickets are only £10. Why would you want to miss out on this opportunity? Please call Brother Qasim, my very capable station manager, on 07722 55 8884. Or visit Facebook, which has the advert at the top of the page, and like our Salam Radio page on Facebook. Listeners, join me once again next week for another wonderful show on the Body Health and Mind Show on Salam Radio.
You're